So as introduced, this is Hyobum from WHO. Today, it's my great honor to be invited here and then to talk about our work on care models targeting older people or people with dementia. So I would like to talk about what WHO envisions about caregiving to older people or people with dementia and what our current knowledge and the next steps are. So the work has been comparatively recently starting. The two important reports were launched within a decade. A World Report on Aging and Health provided concept on healthy aging in 2015, and then based on that global strategy and action plan, we launched a UN-wide Decade of Healthy Aging from last year, which is until 2030. And at the same time, there's also a global movement on dementia, which identifies dementia as one of the priority public health issues. And the action plan and report is really focusing on public health response to dementia rather than treating just as a disease specific program. So although we have started separately, one from life course approach and another from disease-specific approach, we are converging to providing care for older people and people with dementia, and then supporting their caregivers. So under the UN Decade of Healthy Aging, there are 4 action areas from ageism, tackling ageism, to develop age-friendly communities. And now we are talking more about care and services, how to deliver integrated care or provide long-term care to people who need it. And then I would say that interfaces with dementia care. And of course, as you know, the older people who need long-term care, we're also overlapping a lot of dementia, people with dementia. So the care, what is care we want? What WHO is envisioning? We have a concept of integrated care for older people, so-called ICO. So the core is to integrating health and social care services and systems, and then make transforms and reforms in different levels. And what we envision long-term care system is also that service should be people-centered, coordinated, that should empower older people and carers themselves, and then provide continued care, integrated and coordinated care. The care model for dementia is not that different. It is also aiming to provide sustainable integrated care between health and social care systems, between different provider and system levels, and also envisions a multidisciplinary cooperation approach. So the proposed actions include developing a pathway of coordinated care for people with dementia within health and social systems, including long-term care to provide integrated person-centered care. Also, it emphasizes a shift from hospital-based services to community-based care settings. So now we know what we want to emphasize for model for integrated care for dementia. As I mentioned, it should be multidisciplinary, multi-component integrated care. And some of the reviews within our recent report says in some countries, there are a few models like a primary care provider and case management partnership, which has effective in reducing care burden and costs with associated system, and also produce some good outcomes like decreased hospital stays and costs. And then also we have a different aspect to work on long-term care financing. There are some of the lessons learned from this case study of long-term care financing or pricing of services. So a few of them include that public investment in long-term care system is important, and separate funding systems like long-term care insurance may exist in different countries. And then it may help that long-term care funding is dedicated, but may pose problems in coordination between different sectors. And then while where cost control is primary objective and the eligibility criteria is too stringent, there could be some unmet needs. And some of these recent reports and reviews provide some country case examples within our reports. So I would not really go detailed so far, but just to touch based upon. So there's one case example from Qatar. So as you know, Qatar is a relatively small country with a high income resource, and it is quietly centralized and well coordinating between different settings and providers. So they have just recently initiated some program experiments which integrate and coordinate between different settings, from home setting and long-term inpatient, and also coordinating with specialized care centers and community-based residential care services. So the strength of this program is the dedicated geriatric unit in the main national health center is directly working with this district or local level service centers, and then they can assess and provide integrated care for all the people. And at the same time, this has been also fed by the shift in their focus on providing mental health services. In about 10 years ago, the National Strategy on Mental Health has also emphasized a focus the transition towards community-based care from the previously existing hospital or institution-based care. There are a few examples in Australia. As you know, this is also a wide country, and then the program differs between the federal level and the provincial level. One example from Western Sydney, which is run by the New South Wales Ministry of Health, is the program targeting older people with chronic and complex needs. And then this program provides a community-based model, of course, which is patient-focused and coordinated between home care and hospitals. So wherever the patient is, care is delivered in most appropriate settings, from general practice, health facilities, or even by community outreach or community hub. And a general practice liaison nurse has a key role of visiting homes and identifying needs and organizing conferences and coordinating between different providers. Of course, we could not say this program is perfect as it has recently started, and then there's ambiguity in funding as it is split between different levels of government. Some staff are employed by the local or provincial health district, while some are funded by the federal level, or some doctors or general practitioners work on fee-for-service from the private sector as well. So this implementation, while there has been positive outcomes, the implementation has been a little bit challenging in that sense. There is also some transition care programs which provides care for a certain amount of period to improve independence and aim to return and transition people to communities. In Korea, this is one model of social health insurance or long-term care insurance, which covers universally the entire population. So it targets either older people or with people with specific geriatric diseases, including dementia. And the proportion of home-based care is also expanding. So although you might see this universal scheme may be helpful in providing coverage for general population, there has been some pros and cons. which includes that informal care is not covered by the national insurance. So still, the people and their families have a lot of burden to providing informal care. And the family, especially women, are having that burden. And there's also lack of coordination between health and social care system, as we previously emphasized. So there are some of the lessons learned and next steps. So the idea is that really for the future and ideal care, integrated care for older people or people with dementia is really getting attention as a agreed goal and program area. And dementia has been also one of the major target of long-term care. So in the world, including the United States, there have been experiments focused on coordination, continuum care, and integration between health and social systems, between different providers and systems. But there are still challenges such as growing burden and needs for support for informal carers, which has been also mentioned during this conference. So, and then, although this model has been getting a lot of attention and being explored, we need more concrete evidence and proven models from different countries, so that most of other countries, like from lower middle income economies, can also adapt and implement specific models within their context. I will stop here and thank you. And sorry for spending more time.